The shape of things to come. This was a cover of a famous economist magazine that they show at almost all the medical conferences because it always gets there. And diabetes is becoming more and more and more prevalent. If you look at a map like this is what it was like in 1990, and this one just looks worse. Diabetes is spreading everywhere, and the number of patients and the number of people with diabetes is just becoming astronomical. So what is diabetes? We have a vote for not producing enough insulin. Is it too much sugar? Too much carbs. The thing is diabetes is actually very, very, very complicated. And I like to use this as an analogy. Sugar is the fuel that drives our car. That's what our body needs. In order to get the sugar into our engine, which is our muscles, it has to go through your blood, it has to get in. Insulin is the key that unlocks the door to your cells to let sugar in. And so diabetes can actually be one of many problems. When kids get diabetes as a young, juvenile diabetes, what happens is they lose their ability to make these keys. They have no insulin. And when that happens, the only treatment is to replace their keys. If you don't replace the keys, you're not going to work. But you know in the winter sometimes when you go to your car and it's frozen and you have to stick your key and you've got to jiggle the lock to get it open and it takes a little bit longer than usual? Well, that's the analogy I like to use in older people as when they get diabetes. It's not so much that they don't have enough keys because actually very often they actually have more keys than normal. But their ability to get the sugar from here into their car is actually declined. And their ability to regulate how the body metabolizes the sugar and uses the insulin and uses it is not as efficient. Their engine is not working as well. Very complicated scenario, but what this is trying to say is there's a lot of points that diabetes affect to getting your sugar high, and also where there's a lot of medications that have been created to combat these high blood sugars. We diagnose it typically by blood test. In the olden days, anybody know how they used to diagnose diabetes? In the urine. How did they detect it in the urine? The doctor used to taste the urine. If it was sweet, you had diabetes. But in order to have sugar in your urine, your blood sugar level has to be above 10 to 12. And for us, we diagnose diabetes when your blood sugar is above 7. So we're trying to catch it well before it spills into your urine. So that sweet urine, we don't have to taste anymore. But even the better question is why do I care? Blood sugar is just a number. Why do I care about it? The real answer is I care about the big problems and the small problems that diabetes cause. And I'm not saying things are not big problems as being more important than small problems, but I'm actually talking about the big artery problems and the small artery problems that get damaged with diabetes. And the big arteries are your heart, your brain, and your circulation. These are the big vessel diseases that go along with diabetes. The small vessel disease are your eyes, your kidneys, and your nerves. And this is actually why I target treating people with diabetes. I want to prevent these 6 things from happening. I really don't care if your blood sugar is low as long as these 6 things don't happen. There was a drug that came out a few years ago that all of a sudden was found to be great. It lowered your blood sugar. But over time, they found out that more people died on it. And so it's kind of gone out of favor quite rapidly. It does wonders for the number, but the end point was not as good. There are other side effects with diabetes, but these are things that are not as well defined. People get tired, they get blurry vision, they can get more prone to infections. So how do we treat it? The first thing, diet and exercise. Go back to the easy things. Many patients, especially early on in their disease, can control their diabetes with changing in their diet and moving. It's amazing how much moving can help. And it's amazing how little movement we actually all do, especially the young people these days. I consider myself to be too sedentary for my own liking. I like to think I run around the hospital and it counts, but it probably doesn't. I probably should increase my physical activity, but we're all pressured. There are medications. Insulin is not bad. Insulin is good. Insulin is actually probably one of the best ways of controlling the blood sugar, but one of the more complicated ones because people have to give themselves injections that they don't like. But it works. But it's always a balance between risks and benefit. Always remember. But you can always talk to your doctor about your individual situation and see if it's right for you. Oh, and I should say, Dr. Martin is a military doctor. I should have shown a picture of you.
If you don't have diabetes,
yes,
and you eat a lot of sweets,
yeah,
can that cause diabetes?
Can a lot of sweets cause diabetes? Yes and no. Everybody has the ability to get diabetes in the sense that we can cause everybody to have high blood sugar. I give anybody prednisone, I guarantee you after a couple of days your blood sugars are going up. That's one of the side effects of steroids. Diet doesn't help. But if you're eating a lot of sweets all the time, you're going to gain weight. And obesity and that weight increases the likelihood of developing diabetes. It's not absolute. I mean, everybody says the same thing about smoking. If I smoke, am I going to get lung cancer? No, but your risk is high. But then they say, but what about, who is that old guy that always had, that was smoking? George Burns. He was always smoking, and he was the worst. He was 102. It was the worst advertising for continuing to smoking because everybody says, look, he's fine. But eating sugar over all the time does increase your likelihood of obesity, which would translate to higher. But one day having a piece of cake, would that be dangerous? No. I tell everybody, on your birthday, you should have a piece of cake. But your birthday happens once every 365 days. If your birthday is 364 days a year, it becomes a little bit of a problem.